for Tuesday, December 2nd, 2014, focusing on the 2015 budget update, will please come to order, and the clerk will call the roll.
Calling the roll, Ms. Conwell? Here. Mr. Jones?
Here.
Mr. Hairston? Here. Ms. Simon? Here. Mr. Greenspan? Here. Mr. Miller?
Here.
Mr. Brady? Here. Mr. Germana?
Here.
Mr. Gallagher?
Here.
Mr. Schron?
Here.
And Ms. Conley? Here. There is a quorum.
Thank you very much. Do we have anybody signed in for public comment related to the agenda?
No, there is no one that is signed in.
Okay. Items referred to the committee, Resolution 2014-0267.
Reading into the record, Resolution Number 2014-0267, a resolution adopting the 2014-2015 Biennial Operating Budget and Capital Improvements Program Annual Update for 2015, and declaring the necessity that this resolution become immediately effective.
Thank you very much. And as the first part of this process for today, we agreed at the last meeting that we would have Craig Richmond, who's the fiscal officer for Metro, come forward at this time and be available to answer any questions that anyone might have regarding Metro Health's budget. Does anybody have any questions to ask regarding the Metro Health budget?
Through the chair to Mr. Richmond, how long have you been working for Metro?
Thank you. Good afternoon. I've been with Metro Health approximately 5 years, joined March of 2010.
Okay, first time meeting you. Thank you.
Actually, I had the opportunity to present before you all last year when Dr. Boutros and I presented our budget.
Any other questions on Metro Hospital? Councilman Schron.
During the last discussion in our last session, we were talking about the presentation and what its meaning for the budget was in regards to the subsidy that comes from the county. And Dr. Boutros talked about that there was going to be a separation and not a need for that because the improved efficiencies within the Metro system. Can you elaborate as to specifically what the financial records are indicating now, when that need is going to terminate, and your ability to sustain operations based on the internal operations of Metro as opposed to the subsidy coming from the county?
One of the things, if I may, that I would like to do first is I think there was some confusion as to what Dr. Boutros said and what was meant by his statement at the stakeholders meeting on May the 9th of this year. And I would just like to take a second to clarify what that statement was. For the foreseeable future, there is a clear need for annual funding received from Cuyahoga County through the Health and Human Services levy. And how it can be used is the question. And Metro Health has been able to deliver high-value services at low costs through continuous operational improvements over the years. And our clinical and financial outcomes have been extremely positive as it relates to our care delivery models. Our aim and goal is to become self-reliant on the funds for day-to-day operations, and instead have the county, which owns these facilities, to repurpose the funds to support significant capital improvements. Depending on the need, some of the $40 million of annual appropriation could go towards operations. And in exploring options, we have a portion of the funding could be used for capital and a portion could be used for operations. And if I may just provide an example, annual debt service on approximately $500 million bond issuance would be about $27.5 million which would leave then about $12.5 million for programs. So there's definitely a clear need for the county funding for the foreseeable future. The question is just how can it be, how can it be used?
Okay, can you define the word foreseeable?
Foreseeable future, at least through 2016.
And then what happens after 2016 for operational dollars?
What we continue to work towards is becoming self-reliant on the funding, where we would be able to fund operations on our own, and then the funding would be used for capital improvements.
Can we just stay with the operational dollars? Sure. Leave the capital out. I mean, capital can come from multiple different sources. Tell me about the operational dollars, and you use the word foreseeable, and you use the definition of 2016. Does that mean after 2016, you will not need these dollars for operations? Don't mix apples and oranges, because they truly are apples and oranges. We don't use our mortgage payment to pay for the bread on our table. So let's make sure, let's keep those separate conversations.
In 2016, our aim and goal is to be able to be self-sufficient without the $40 million.
Okay,
for operations.
So that was what I believe Dr. Boutros said, that in 2016 you will not need the $40 million for operational efficiencies and operations of Metro. Is that so? I'm not hearing anything different from what you're saying.
And then that is correct. I just wanted to clarify that is exactly what was said at the stakeholders meeting.
Right. Now, how you get capital improvement is a different concept, and Dr. Boutros, at least my recollection, was the suggestion that if we, the hospital, wean themselves in 2016 from any operational dollars, the suggestion was, would the county then consider using those same dollars for capital? Was the way I recall that presentation. Is that an accurate reflection of?
That is correct.
Would you mind also providing us with those slides that were presented so we can all have a copy of those? I don't know if we have those in our records that were used.
From the stakeholders meeting? Yes,
stakeholders.
we can provide those slides.
Thank you.
Councilman Jones.
Thank you. And I apologize, I did not catch your name when you mentioned
My name is Craig Richmond.
Craig Richmond. Okay, well, Mr. Richmond, we've heard that statement, not needing $40 million, and I understand the context you're placing it in, but I'm concerned. When I hear our county hospital does not need $40 million to meet the needs of the least of us in this county, it's concerning. And I am fully committed to the capital improvement that we know this hospital needs. But I'm concerned about that. And I really want to take this slowly and really delve into more than just in committee what that means to not need $40 million. I mean, I really just want to impress the weight of what I'm really hearing when I hear $40 million is not needed, even if it's in a few years. What does that mean? What does that mean to the hospital? What type of transformation has to take place for you to operate without $40 million? So that's more of a statement than a question, but I just want to throw it out there. Maybe this council needs to look a little more closely to understand just what you mean by that, but that is a lot of money to say you don't need after a few years.
Councilman Jones, to your point, yes, I think we need to continue to work together and, explore all different options. It is a significant change from what occurs today. And one of the things that Metro Health has been doing over the years, actually it dates back to 2009 when we first began to implement our patient-centered medical homes. We have been working very aggressively to improve our operations, and I would say in the past year, based on the review that the 3 credit rating agencies has done on Metro Health's financials, they've even taken note of our improved operational performance, which translates to our improved financial performance, which shows that we're on our way, okay, as it relates to significant financial improvements. The one thing I would throw out there is that, as we all know, there are a lot of changes that occur within the healthcare industry on a year-to-year basis. So if Medicaid expansion was not continued as of July 1 of this year, obviously that could change some of the circumstances. Other changes that could take place at the federal, state level could have an impact on Metro Health as well, where various other things would need to be evaluated.
Anything else?
Thank you, Mr. Chair. My question has to do with not only what Metro Health is doing, but what the other major hospital systems are doing, Cleveland Clinic, university hospitals. And the question comes, we're continuing to build all these facilities. I'm just wondering if there's a point of this is increasing the cost of healthcare across the whole county, and possibly having a situation where we're going to have excess capacity with the continued building. You care to comment about that?
I think at this time to, comment on the capabilities of the other institutions and how Metro Health fits within there is, I guess I would like to table that at this point in time. I really don't have a comment to it. I would just, one note, I guess one thing to mention would be Metro Health does have a very special place within this county. We've always been committed to providing care to all residents of Cuyahoga County. I think based on what we've been able to do in the county and over the years, and we actually continue to increase our programs over the years, I think then that allows both the other organizations within Cuyahoga County to then do what they do best.
Well, I still, I know you don't want to comment on this, but, from my way of thinking, I could remember the time not too long ago where there was a gas station on four corners, four gas stations on a corner, and over time, what's happened is those gas stations, ultimately, they've got to be weaned down to what the market is going to be able to support. And I want to wish the best for Metro Health, because that's the county hospital. I'm just a little bit concerned about all these hospital systems building the clinics, and I'm just wondering if we're going to get to a saturation point where maybe in the future it's going to hurt Metro Health's ability to continue to have this low cost provider of health insurance.
When we take a look at Metro Health today, and we take a look at the structure that Metro Health operates within today, it really is a model that was built for the past. As we all know, there's been a significant push going from inpatient business to outpatient business, going towards providing care where people work, live, and play. And really, that's what we're focused on doing, is being out in the community where our patients live, work, and play. As we continue to move forward with the campus master planning, the footprint of Metro Health would look significantly different than it does today, okay, on West 25th Street. So I think the one thing that we have the advantage of doing right now is we don't have a significant amount of funding locked up in bricks and mortar. And I think what we have the opportunity to do is actually build a healthcare delivery system that would prepare us for the healthcare in many years to come.
Council President Connolly.
Mr. Richmond, regarding the money that we give to the county, so that $40 million or whatever the figure is, we give that to you to provide this care for the indigent. Are you saying that you are going to make your operation so efficient that you would take this $40 million and then use it for capital improvements as opposed to providing the health care? Is that what you're saying?
We would continue to provide the health care, but
I
based
mean, you're
on...
mandated under the state statute, right, to provide that, right, or under the...
Correct. I mean, what we do is when a patient presents himself for service, we will care for that patient. No, we will not be abandoning any patients. We will not be abandoning any care. What we will continue to do is we'll continue to, as you mentioned, improve our operations, continue to become more efficient, and with that, continue to generate the cash flow within our organization to cover what the $40 million is covering today, which then, in essence, the $40 million could be used for capital improvements.
But are you allowed under the state law to use the Health and Human Service money for capital improvements?
Currently, today, we are not.
Then how are you going to do that?
Right now, with County Council, we are in the process of exploring different options, okay, in order to see how we could go about using levy dollars in the future for capital projects.
Well, I am a great student of the law of unintended consequences, and I would just give a caveat to all of my colleagues that when you're talking about changing the state law, we need to be very, very careful and know exactly what the long-term ramifications of these things are. I mean, I don't know exactly what changes you're approving, but this is not something that we just willy-nilly change. So I just hope all of you will do extensive research and investigation to find out the consequences of these kinds of changes.
Okay. Thank you very much. Councilman Tron.
Based on some of my colleagues' comments, and I do congratulate you on an aggressive and it sounds to me by 2016, which should be an effective way of running the medical care business in a little bit different way. One of the big things you were one of the forerunners on paperless and
Yes, sir.
elimination. I mean, you were ahead of the Cleveland Clinic, I believe, on going paperless and just the amount of volumes of, if anybody's walked into the archives and see what's stored and how much is produced and the copies and the recopies and all that is all done. You folks are on a digital basis, I believe, for almost all your patient care.
Correct. The journey goes back to 1999 when Metro Health got engaged with a company at that point in time known as Epic. And over the years, with the relationship that we formed with them, we've been very successful in implementing the electronic medical record, which has helped us with a lot of our significant clinical improvements today.
And
So
that
thank
should
you.
yield not only probably faster care, better information to your patient, but a significant reduction in cost. I mean, just the multiplier effect should be out there, and every year that you're in this, it just increases the savings, it seems to me. So my congratulations to you in regards to that.
Thank you.
And that is, there's some of us who believe that we have that same 50 plus to maybe as much as 100 million that could be saved in the county operations by doing some of the same kind of things that you did in Metro. And I really believe that, and I hope that the next administration is going to be very aggressive in this, because it does yield that kind of savings that we'd be looking at out there. And $40 million, as big as that number appears, when looked at the totality of what you folks are doing, is not a number that we could not see that same kind of yield here in the county. So my congratulations to you. I think we have a $50 to $100 million number that could be saved within our own county operations out there. The question that Mr. Germana was asking was on bed utilization, and the relevancy is not to criticize or comment necessarily on the other facilities here in the county, but it's to recognize that there are, as you indicated, medical care is moving in a different direction. Most of us also believe that the care that can be provided at home is probably, and all the doctors and everybody recognizes, probably a faster recovery for the patient. So the model is going to change, as Mr. Germana is talking about, and that's why there is relevancy, is to the bed utilization for all the facilities versus the bed need. within the county. And so I think that as you venture forth into with public dollars as opposed to the other institutions, what is the bed need under the new medical care procedures that are going to be down there? So it's a very relevant question, I think, as we go forward.
Currently today, Metro Health has approximately 700 plus licensed beds. We do not use all 700 licensed beds, but that would be, that's what we have capacity for. We today operate, we have about 420 beds that we operate, and it's about at 90 to 95% utilized. But as we look into the future, and as we look at what the demand is, how healthcare is changing, how the delivery of care is changing, that footprint as it relates to what are the needs at the Metro Health system from a bedding standpoint will change significantly. We have worked with a company called the Advisory Board Company, and they have helped us with the forecasting of some of the projections.
Okay.
Chair, just one final observation, if I can. You know, we talk about the efficiencies and the hospital moving to a more profitable position, but the hospital also took a strong position with insurance carriers are now receiving higher, if I remember Dr. Boutros, receiving higher compensation from the insurance carriers for the same services being provided. So not only are you reducing expenditure exposure, but you're also increasing revenue opportunities, providing the same services by renegotiating your provider contracts. Is that correct?
Yes, sir. Last fall in 2013, we successfully renegotiated the contracts with our top 5 managed care companies. And one of the things as we look forward where we have opportunity is as part of the Affordable Care Act and also in keeping patients healthier and out of the healthcare delivery system, we're focused on looking at different type of risk-based or shared savings reimbursement methodologies. And I think Metro Health is very well positioned for that based on what we learned through the Medicaid expansion pilot that we participated in last year. And in essence, we saved the government about $50 million as it relates to the success of that program.
So if you know, or how much additional revenue have you received from when the contracts were negotiated, when they went into place, from where you are today for providing the same services?
I want to say in 2014, we're estimating that we have received approximately about $15 million in additional revenue as related to our contract negotiations.
Okay, so we're at 15.
Approximately, yes, sir.
So that, in its sense, if you want to look at it from a value perspective, in terms of the 40 million, then would be 15 less of the 40, if you were looking at it that way, through efficient operations on the revenue side, not on the expense side alone. Is that a fair assessment?
Yes, sir. And, two things that we gotta, that we'll continue to look at is where we can continue to leverage our clinical excellence and share in the savings that we can generate insurance companies. And also one of the things that everybody's focused on around the nation is how do we further contain costs as it relates to healthcare delivery and further drive efficiencies within what we do.
Great, thank you.
Thank you.
Okay. Thank you very much.
Mr. Chairman,
Yes.
just one final word on this. Listening to my colleagues and sensing that there is some uncertainty and confusion about statements that have been made by Metro about the campus transformation project, about the future of the so-called subsidy, all of these issues. It's my position that the county owns the hospital. And that means the county council and the new administration will be reviewing our relationship with the county hospital starting in the new year, and that nothing should be assumed in terms of what that's going to look like. I think we're going to need to start fresh. We're going to need to analyze our relationship with the hospital and the proposals that have been made. And so what I had to say as the chairman of the Health and Human Services Committee is that we will be part of deciding what the future of Metro Hospital is. And nothing will happen without our consent. And we will be looking forward to working with the new executive to define what that role is. So we own this hospital.
Thank you. We really need to preserve time to deal with the budget amendments.
Thank you.
Councilman Jones,
Thank you.
just
Councilman
requesting
Brady,
brevity.
Council Brady put it very well, and I echo those statements. So my simple question really was going to be, what was the profitability of the hospital in 2013 and in the few preceding years, to give me some sense of where we're going with this move towards not needing the subsidy?
In 2013, we had operating income of $18.9 million, which represented a 2.2% operating margin. And in
18.9 million in the black.
Yes, sir. Yes, sir. And in 2014, we budgeted for 18.5 million, and we're projecting to at least end the year at 25 million.
Where were you in 2012?
In 2012, I would have to get back to you on that, Councilman Jones, so we can provide you that information.
And what's important for me there is the new administration came in 2013. So I'm looking for a little pass. And I don't need it right now. So we certainly can hold it, but I didn't hear you. 2011 we came in. No, the hospital's new administration. Dr. Boutros and the administration came in 2013, the middle of 2013.
Okay.
Actually, I do have the information before me. In 2011, we had $3.4 million in operating income, which represented less than a half a percentage point of a margin. In 2012, we had $10.3 million. In 2013, I mentioned $18.9 million. And then in 2014, we're projecting $25 million.
Have we been in the red at any point in the?
We have not been in the red in over the past, I want to say, 6 to 7 years.
Okay, thank you.
Okay. 3 consecutive years moving up. Congratulations. Thank you very much.
Thank you for your time.
Have a nice day. Okay. Now, with that important discussion completed, it's time to move on to the discussion of the 2015 budget resolution, and you have on your desk an item entitled Amendments to Resolution 2014-0267, which is a list of possible amendments. And in a moment, I'm going to go through those items, and after I go through them, I'm going to ask if the administration or the executive-elect have any general policy comments or input on the budget document as a whole, in addition to the fiscal discussion that we've been having. And to look at these items, first of all, we have the juvenile court. And the juvenile court requested $2,850,000 to maintain the higher level of residential placements that's required, and requested $500,000 for the shelter pilot program and $500,000 for detention officer overtime. And in this list, we're recommending the two $500,000 items, and we're recommending $1,500,000 out of the $2,850,000 on the idea that we should get a better handle on how much is needed going into the new year, and give the new administration the opportunity to monitor this, but also recognize that the need is out there, and provide some of the money. At this point, I would like to call upon representative from juvenile court, either Karen Lippman or Marita Kavalak, to provide us some additional information about the shelter pilot program. We've just passed out the Section 701.04, which is regarding requests for new programs or services, and basically that item has 4 parts. We're looking for information on the description of the program, what the cost is, how the program's success would be measured, and how what staffing levels would be required. And if you look at the second last page that's been passed out that says Cuyahoga County Court of Common Pleas Juvenile Court Division Secure Shelter Care Pilot Program components. This kind of gives a brief description that focuses on those items, but I would call upon on the court representatives to take us through that a little bit and explain why this program is needed and what we hope to accomplish.
One second. Good afternoon, everybody. I'm Marita Kavalak, the Court Administrator for the Court of Common Pleas Juvenile Division. I'm just going to provide a few prefatory comments, the most significant of which is we are overwhelmed with gratitude for your very deliberate and serious consideration for our request for additional appropriations. And we are utterly thrilled that you are proposing to amend the original budget to include $2.5 million. Quite honestly, that we feel that this is unprecedented with the way we have been able to inform and discuss and deliberate about what our needs actually are to do what's in the best interests of children and families here in Cuyahoga County. I'm going to rely on my colleagues Karen Lippman and Tim McDevitt, who is the Director of Probation, to give you some particulars about the proposed shelter care pilot program. One comment I suppose that I should make is that safety, security, and costs are obviously driven by population in the detention center. It's just unbelievable on any given day how there is a near like domino effect if the population increases, especially if it increases quickly, which can happen on any given night depending on arrests that take place around the county, what the alleged crimes might be, and what the outcome is of the detention screening that we do so that we make informed decisions about who to let into the detention center. We have worked very, very hard, not just in attempting to manage our population and in limiting who is allowed in and then how long they stay, to determine what other types of alternatives could be included in our continuum that A, hopefully mean we're using our money smarter, and B, would provide better outcomes for the kids that we are challenged in dealing with on every single solitary day, 24 hours a day.
Ms. Kavalak, we have 10 items to discuss. It
Okay,
needs to be
I'm
very
done.
brief and particularly narrowly focused on the shelter pilot, which is the new program that's under consideration.
I totally understand. I just thought that some of that background might be relevant. So now I will rely upon my colleagues to give you more particulars about the pilot. And thank you again.
Okay.
Karen Lippman with Juvenile Court. So in a very brief synopsis, our shelter pilot is really addressing the fact that we have our secure detention facility and we have our staff secure shelter facilities. And we have a need for something that's sort of in the middle for youth that have a history of probation violations or from running away from that staff secure or from home detention facilities. But the secure detention facility is really more than those youth need. It also, based on best practice evidence, that if you place lower level offenders or lower risk offenders with higher risk offenders, that they will then sort of become higher risk offenders. So this is sort of filling that need for in-between for youth that do have a tendency to run away. It's a safe place for them to stay before their next court hearing. And that's really what the sort of the nuts and bolts of the secure shelter pilot program is. The $500,000, although we don't have a per diem yet because we would have to do an RFP for services, would be approximately about 6 beds is what we're looking at. So these would be youth that are probably lower level offenders, misdemeanors, but have a need for that more secure locked facility.
Okay, thank you. We're going to continue on through the items. We'll probably call you back later if we need further information during the discussion. Okay,
Thank you very much.
The second item is the prosecutor's office, and this is the 2015 funding for the additional investigators to follow up on the information that the prosecutor is obtaining from the rape kits that are being processed. And this is an item that earlier in the year we pretty much gave the green light on that we support in order to get these bad folks off the streets. So that's what that item is. Item 3 is for the Personnel Review Commission, and they requested about $650,000. We're recommending about half of it, and the Personnel Review Commission is intending, by general agreement with the, based on the charter language, that they should expand efforts in the area of civil service testing, and also that they should run the classification program, and this provides 3 staff persons and some technical and office support to enable that to happen. Item number 4, $150,000, County Planning Commission. This is to do the county-wide housing plan that we discussed as part of the process in approving the $50 million bond program for demolition. Number 5 is Department of Senior Services, and I'm going to turn to Ms. Conwell to elaborate on that item.
Thank you, Mr. Chairman. We would like to increase the bedbug assistance funding to accommodate additional $50,000, and that is based on we've exhausted all of our funding for this year, and we already have a waiting list of several individuals with price contracts and everything of how much it would cost, but we don't have any money to move forward. We only have $350 remain available at this time. These individuals that we've serviced so far ranges all the way, not just City of Cleveland, it's a broad spectrum across the county of people that have been serviced already. And so what I'm asking is that we look into increasing the contract for an additional $50,000. We have 25 already set aside for 2015, but that will not be enough because as soon as we open up 2015 gets here, the people that are on the waiting list already will use that up. So that will occur, but to get us through the third quarter, the remainder of 2015, I'm asking for the increase of $50,000. Thank you.
Okay. Item number 6 is a program that I've been working on with staff for many months, and believing that the time to bring forward new programs is during the budget process. And what this would do is create a third module in the county's educational assistance program. It would be a college-level co-op intern program. And co-op intern programs are very effective because they help businesses. They also provide students real-world experience, and they also encourage students to remain and live and work in Cuyahoga County after their education is completed, because the internship program builds relationships. Following Section 701.04 on new programs and services, the last sheet that is handed out provides a summary of the program, and I just described the services. It's going to be small business focused, and we're looking for an intermediary, someone like Cotw, to structure experiences that almost all businesses need. We're dealing with the fact that often businesses don't know how to effectively use interns. We feel an intermediary like Cotw could help put a program together that businesses will find useful. Budget is $100,000. Service milestones in the first year. This would be seen as a pilot, and the hope would be to see whether we can provide a useful program for a significant number of students at reasonable cost. And over the long term, the evaluation guidelines would be number one, whether businesses find it useful, two, whether students find it helpful in their education program, and third, whether it encourages students to live and work in Cuyahoga County. And staffing level, depending on how it's administered, we think it probably would not require additional county staffing, likely be done contractually. So that's item number 6. Item number 7, I will turn to Ms. Simon on the sustainability.
Okay, thank you, Mr. Chair. This item will enable us to actually fund the Department of Sustainability, which was vetted through committee and went to council and passed. As we discussed, it's a modest department consisting basically of the director and a staff person. So it's relatively small, but we expect big things, and ask for your support to enable this department to get up and running.
Okay, thank you. And item number 8, I'm going to turn to Council President Connolly on the Grant Coordinator Department.
Thank you, Mr. Chair. When we got a report from the state auditor, one of the recommendations that they had was a grant coordinator to coordinate the various funds that come through the county and go to the various agencies. And so my proposal is to put this item in the budget for approximately $300,000. I think we're talking 3 persons and $30,000 for operations, but I think that in the long run, it'll probably save us money because it will have the ability to monitor the various programs that we disperse money to.
Okay, thank you.
And also, they would correct an additional item on the audit.
Okay, I would like to skip for just a moment to item number 10, which is the Cleveland Hearing and Speech Center. As you know, we appropriated $104,000 for 2014 to provide assistance to low-income people who need help with hearing aids. And the intention when this was done was that we would also provide funding in 2015 through the 2015 budget process. However, the Hearing and Speech Center has been able to use some additional resources, and so far have not needed to use any of the $104,000 that the county has provided. So we believe that we can hold off for a while and see if any additional money is needed in 2015. So that might might occur down the line but is not needed at this time. At this point, I would like to call upon Director Murray to explain give us a summary of the OBM technical amendments.
Good afternoon, members of council. Chris Murray, Office of Budget Management. What you have before you is 3 pages of corrections, realignments, and changes to expenditures and revenue. And I'll go through each of the sections briefly to conserve time. The section 1, which is through items 1 through 21, those are essentially corrections that we found, or errors that we found in the budget, in the base budget and the budget that you've seen since our initial review with council. For primarily the largest, well, there are some reductions, but primarily there are a couple of instances where the facilities management budget was insufficient to cover the indirect costs. And indirect costs are charges that the general fund levies against special revenue funds. So we need the appropriation in the facilities fund so that we can then charge back revenue that comes to the general fund. The second section is literally realignment. So we're talking about a zero impact to the all funds budget, but in some cases, appropriation was posted to the wrong index code, same fund, but wrong index code. So we're making those changes there. Again, that is zero impact. Section 3, which is items 50 through 77, those are revisions to the resolution that need to be done to the resolution is in fact correct. You'll see a preponderance of the issues in this case are solid waste district. They're generated due to the resolution, budget resolution passed by the solid waste district. So we want the budget to reflect the wishes of the district. You'll also see that there's an instance where we're moving appropriation from one levy fund to the other. I won't bore you with the details, but essentially we use both levies to support the Health and Human Services operations, and our particular software hard codes it to one levy fund. You will have seen this in prior years. We just need to realign the funds so that expenses are borne by both the 4.8 and the 3.9 mil levies. And then finally are some revenue revisions. Again, just to ensure that we are properly accounting for our revenues. And in this case, we have an instance where revenues for one of our public works funds really should have been posted to a second fund. So we're making those corrections.
Okay, thank you very much. I would now like to, we've gone through the items, we've looked at them individually from a fiscal standpoint. I would like to ask if anyone from the administration would like to offer any input, suggestions, comment on the overall budget as a whole from a policy, political, or programmatic standpoint. There's been some discussion in the meantime, but I wanted to see if anyone has anything to bring forward at this time. Anything? Okay. I would now open it up for any questions or comments by any of my colleagues on any of the items. And then we're going to then we're going to need to decide whether we want to vote on the items as a package or to vote on them individually. Ms. Conwell?
Can we ask a question of them?
Absolutely.
All right, through the chair to Karen Littman. And basically, one of my questions is, what does the $500,000 cover in the shelter pilot program?
What we're proposing for the $500,000 is that will be for a vendor that will be secured through a request for proposal process, and it will be simply a per diem. So it will be a room and board cost.
Just room and board?
Yes.
And so this is, do you have any ideas right now of where this vendor may or may not be? Could it be possibly Carrington Youth Academy or?
Well, what we'll probably do if we proceed with this is all of our local residential providers will get notice of it and we'll see who responds. So it could be, any of the current providers, or not current providers that want to provide this service for us. I think the court's hope is that it will be someone that is local, but you just don't know who's going to respond. I can say that when we do put out our staff secure shelter request for proposals, we do not get a lot of responses back from that. So it depends on who responds and quite frankly, who has the facility or the space available, because we are looking for a locked facility. And some of the residential providers may not have that currently as part of their structure.
I'm still not convinced. At Public Safety today, we had a contract move forward for the safe and secure or the unsecured program, and so now to me it appears that we're adding another step to house children. We have the one that's unlocked, then this would be a pilot program for a locked facility, but the youth that will be in it, we don't want to get impacted by the detention center.
Correct.
Facility. But the question I asked in committee was the children that would be in this pilot program, where are they now? And Ms. Littman shared that they're either in one of the facilities that we have already. So I guess that's where I'm kind of stuck. In theory, this would be just wonderful to have something additional for children to be in, but we've already housed them, so that's kind of where I'm stuck, and I'll listen to some of maybe my other colleagues' comments on it and how they feel.
Good afternoon. I'm Tim McDevitt, Director of Probation Services, and if I could just highlight a couple of Karen's points. The court has been here a number of times to talk to you about the difficult cases we have in the detention center and the gang prosecution that's gone on. This is really the other spectrum of the kids that we deal with day in and day out at the detention center. And the best way to highlight this would be to give you a couple examples. The kids we're talking about are chronic runaways who have low-level offenses. Now, that's not to say they have low need. They often have high need, but we're faced with three choices. Putting them into the detention center with kids who have very serious charges, and we don't think that really helps them. And then we put them at shelter care, and sometimes they run from shelter care because it's an unsecure shelter, or home detention, and they run from home detention. So what we're looking for is a secure facility to hold these kids who have significant problems but a low-level offense. And an example of that would be a girl who's been on probation for a period of time, who we, maybe for a low-level theft, low-level domestic violence, who runs away chronically. We find out she may be prostituting herself. We bring her back. We try her at shelter care. She runs from shelter care, winds up back with the people who are prostituting her. We get her again, and then we're faced with either keeping her in the detention center or putting her in a shelter care she's already run from. So we're looking for something that is a little bit more than the shelter that we have.
So, and that brings me back to where I'm still stuck at. So do you think we really need unsecure shelter?
Well,
Do we need those facilities at all?
For the majority of our kids, unsecure shelter does work. Most of our
Okay.
kids do stay
the
there, and,
majority.
and we would only want to provide the level of service that they need there, because secure shelter is more expensive.
And my other question, just a confirmation, the 500,000 was gonna cover 6 beds?
Depending on the per diem that we come back with,
And this pilot program, this 500,000 is for just a year, or is it for 2?
just for a year.
A year to try it.
Okay, thank you.
Mr. Chair.
Okay. Before we proceed, I had hoped to, when I asked that broad question before, to get some response, but since I didn't, I think it's necessary for me to share with all the council the discussions that I had with Executive Fitzgerald and Executive-elect Budish in the last couple days, so that you can factor it into your decision-making as you see fit. Executive-elect Budish suggested that that if we can hold off on some things, and that he was in the process of making a deep dive into the budget with some of his staff to see what was really necessary, and wanted to retain maximum flexibility. Executive Fitzgerald said that he did not want us to constrain the new executive, and when I asked him, well, does that mean that you don't want any of the items on our list added to the budget? He said, not necessarily, but I'd like you to apply the same standard that you used on the capital program, which is that things that are important and very time sensitive could be included, but things that don't need to be done immediately, we could hold off on. So I just want to share that. I would also say that that we're the appropriation authority, and the executive is the executive authority, and the executive has a lot of flexibility on how and when to spend money. So even if we budget items, it only constrains the executive to a certain degree. So I wanted to share that, so that I was not sitting on information that others didn't have. So at this point, I would ask if others have questions.
Yeah.
Yes.
Well, you kind of put an intermission in the whole discussion process with that statement.
I did.
But I'll ask a question since the folks are at the podium. You said you were looking at 6 beds, six whatever. So if I did my math, that's about $228 a day per bed. And I know in the committee we talked about not necessarily understanding what it currently costs us to house an individual at our own juvenile detention center. But let me ask you this. Would the Euclid jail be precluded from holding these folks? If we set aside 6 beds?
You can't put youth in the same facility with adults. There has to be a sight and sound separation.
What is that sight and sound separation?
Well, they can't be in the same room. They can't see. They can't hear.
Okay, let me ask you this. If we were to contract with one of our municipal jails and make it exclusively a juvenile facility with 6 beds at a rate of even $85, which is what our jail is currently, our adult detention center is billed at, would that suffice the need?
Well, youth have different needs than adults. You'd have to provide education. You'd have to provide, there's different needs that they would have to meet that you don't have in an adult facility. And in our little intermission, I actually did a very rough estimate as to how much it does cost a day. And it's about $285 a day,
Okay.
based on an average daily population of about 160, which is really rough what I did sitting at my seat in between meetings. So,
Right. Okay.
and we're looking, when we looked at the 6 beds, we estimated 225, between 225 and 250 as a per diem.
Okay. All right, thank you. Now, back to the statements made during the what I'll qualify as the intermission. If it's the request of I find it ironic that there was a request of the current executive not to move forward with the spending any money when he brought forward that we spend $9-point-some-odd million on the Euclid jail, not on the Euclid jail, on the casino revenue, and the bridge and the bonding, yet he asks for restraint on this. I find that ironic and hypocritical. If that's the case, then items 5 through 9 then would come off this list, because these other items, 1 through 6, or 1 through 4, and number 10 relate to agencies outside the control of the executive. So is his desire to strike even items that are beyond the scope of the executive's purview? And since I don't see him here, I guess, Mr. Miller, based on your conversation, was that his intent?
The conversation called for general restraint, but was very nonspecific, left it to our best judgment. Councilman Brady.
Since we're all sharing here, we had this discussion earlier. I had this discussion with Councilman Miller earlier, and it would just be my point of view that if the administration is not willing to come forward and say what they're for and what they're not for, then we're going to have to decide that ourselves.
Councilman Schrein.
But I do recall 4 years ago, one of the requests was, rather than having the county commissioners putting things through it in the last 2 or 3 months, it was suggested by then county executive-elect that if they could be deferred for the new administration, he would have preferred that. I'm hearing that same voice today. I'm prepared to defer every one of these, to be honest, and let the new administration bring forth and tell us what they want to see, with the exception of the rape kits, to be in all candor. And so, because you've got criminals on the streets, so we just heard from that.
I'm sorry, Mr. Chair. If we're gonna say, something's valuable to one council person, then, that's a value judgment of criminals versus other items that juveniles are on the street, So I just want to say that I don't think any of these items are unreasonable. We have been sitting here now for 4 years, hearing testimony, sitting through hearings, understanding the systems that we have in place, and I think fully understand and comprehend what's needed, each and one of us. And I think we should have the ability to vote on these items. I think everything here makes sense, including the rape kits and the council president's proposal. We've sat through audits after audit indicating we need to have this additional item, and let's vote on it. I think this is valuable. In terms of your pilot program, I want to comment. It's a pilot program. Let's see if that makes sense. There's kids falling through the cracks. They shouldn't be. This is a unique area where we need to address these kids who are getting caught up in things, and you can't contain them. They should not be at the juvenile detention center. Maybe we can convert at some point one of the jails separately, a municipal jail, into a, I like that idea. Is the time now? We can't do it now because of these other needs, but yeah, maybe that's a long-term proposal on how to work together with municipalities. So my position is let's vote. I think these are all reasonable. Nothing's outrageous, and it doesn't impact the incoming executive's agenda at all. I don't think these items will impact that. It will enhance what we've done. And really, at this point, we're the ones with most knowledge, and I think we should move forward.
Councilman Germana.
Mr. Chairman, I look to you, I think the answer is obvious, but in order to pay for these, the money's coming from lessening the reserves on the Health and Human Services levy, a general fund. Can you just comment about where this money is coming from?
The money primarily comes from the Health and Human Services Levy Fund and from the general fund. The prior roll-up that we had did show that there was an excess of revenue over expenditure for 2015. So as I recall, Director Murray, I think I know the answer, but I'm going to let the director and not test myself.
Thank you, Chairman Miller. I just did a quick calculation, and the general fund impact of the items of the amendment list is about $2 million annually. Doesn't hurt you in 2015, but in 2016, the excess now this is budget now, excess revenue budgeted over the budget as we currently have in the schedules is about 1.6. So what that means is essentially if we spent 100% of our appropriation and then added this particular list, we would be slightly short. But the good news is, as a rule, we tend to spend under our appropriation measure.
So, Mr. Chairman, I think I heard that this is not going to reduce any of the reserves of the general fund or the Health and Human Services levy.
What the director indicated is that that if we spent our entire budget, which we usually don't do,
Correct.
we would spend reserves to the tune of about $400,000, which would be a very small difference.
Sure. So there is some impact based on the numbers in the schedule now, but in reality, you tend to spend under what's appropriated. So you're probably, more than likely, you will have sufficient reserves even after this.
While we bring this up, I would request, after whatever we pass out of today's committee meeting, I would like if you could convert it to a roll-up so that we could have that prior to the council meeting next Tuesday, so that we'll have a clear understanding of the fiscal impact of what we're voting on. Councilman Germana.
So, Mr. Chairman, I just, these are kind of obvious questions, but I just want to vocalize them. We appropriate money, but the new administration, really it's going to be their decision whether to spend that or not.
The executive has a lot of latitude in this area. As we saw at one point, we provided money for additional child care workers, and it was quite some time and only to some degree that additional money got spent. So they have a lot of latitude. This would authorize the expenditures, but we cannot require the administration to spend money. Councilman Greenspan.
Great, thank you. Mr. Murray, just real quick, on the pilot program, and basically on item number 1, the second and third item.
Yes.
Could just explain the qualifications as to why we can use HHS levy and PA funds for those 2 items?
Well, the use of the Health and Human Service levy is It was purely under the discretion of the county commissioners, and now with the charter government, it is under the discretion of both the executive and county council. We have chosen to use Health and Human Service levy funds for certain judicial functions because they're primarily of a social service nature. And since we have the broad latitude to classify social service expenditures, what they are, we've used this as a primary source of funding for juvenile court. And based on the amendment, that'll be a $2 million impact to the levy. And what that will mean is we would recommend use of some of the public assistance reserves to cover that.
So you're saying that these both basically are room and board expenditures,
Yes.
and the HHS levy qualifying language allows us to use that for inmates?
It allows us to use it for social service functions. Inmate services, to my knowledge, and I'm not a prosecutor, but that, based on the opinion we have, that was not considered a social service function.
Right, and we heard today that at least $500,000 was room and board only. No services, no medical treatment, no educational treatment, just purely room and board. So if it's just room and board, is that a qualifying use of HHS levy dollars if it's only room and board?
Based on past precedents, yes. We've cashaded or classified this similar to the way we viewed board and care expenses for children and family services.
So
in many cases, you're talking about similar group of kids.
So to broaden the discussion, if we're running a deficit in board and care in the county jail, are you saying we can use HHS levy dollars for board and care in the county jail?
To my knowledge, I'll preface my statement, to my knowledge, board and care expenses are considered general fund.
Well, that's what this $500,000 is.
Board and care expenses for adults in a jail setting. This is not, to my knowledge, this is not considered a 100% jail setting.
That's it. Well, yeah, I don't get it. No, I understand that, but trying to, I know we can use general money in the HHS. HHS can't go to general.
Right.
But
We have
I'm just trying to understand the 500,000. I haven't heard testimony on the 1.5 million, but the 500,000 we heard today was purely room and board. And you're saying based on the age, if a violent offender is charged with a felony and they're 17 versus 18, we can use HHS dollars one way and differently based on a birthday, not the quality or the specificity of the need or the use of the money.
What I can do is I can provide the prosecutor's opinion that we used in order to make this classification. But essentially, we're talking about room and board for children. We view it as the same as board and care on the DCFS realm.
Okay, all right, yeah, I'd like to, I'm just trying to clarify it. I'm not challenging it. I'm just trying to clarify it. Thank you.
Okay. People are getting restless. We got to make decisions. What I would like to do, first of all, is to turn your attention to the OBM technical amendments. And I would like to bring to your attention on the OBM technical amendments that there was a question about the $80,000 item for the Court of Appeals, which is in the current version of the budget, but that OBM is not recommending. This item is for the Court of Appeals to upgrade their system and fully implement electronic records. And so what I would like is for someone to offer a motion to approve the OBM technical amendments either with the $80,000 for the Court of Appeals or without the $80,000.
Mr. Chair, I have a question. The Court of Appeals, as we found out when we first got here, we were actually paying money. We were the only county in the state that was paying money to support the Court of Appeals. Now, I know that we have to provide space for them, copiers, maintenance, that kind of stuff. But is this records a part of that, or is this a part that the state has to pay?
Well, my understanding
Before I would
is
vote, I'd like to have a clarification of that.
the state has picked up the salaries for the Court of Appeals. But
They have to
we're-
run, we have to provide a space for them, but then we don't have to pay other stuff. So is this records, phones, all that kind of, but is this records a part of that we have to pay? I mean, I'd like to have a clarification of that before we start paying this money.
Can you provide any input on that?
I don't know off the top of my head, but I can certainly look into it.
I think we have to investigate that,
Uh,
because it's a record-keeping provision that's part of the
Mr.
court.
Mackler?
Yes, Mr. Chair, to the Council President. The county is responsible to pay for operating and capital expenditures, but the state is covering personnel expenses. So this is considered a operating/capital expense, as it's a software program. So that's why the county would be responsible for this portion.
Okay.
Do we want to hold off, or are you content on the 80,000? It's not urgent. We could,
If it's not urgent, we'll hold it.
okay, then
You know
I.
what? Well, if it's gonna get them to fully electronic filing,
That's what
let's
it-
just move it, and if they owe us back, they'll owe us back. But I don't think they're gonna owe us back, so I wouldn't wanna handcuff them if they're moving in the right direction.
Is there a motion then to approve the OBM technical amendments, except that the $80,000 for the Court of Appeals for the electronic records would be retained in the budget?
Just, Mr. Chair, just a funding question. Where, is it coming out of the general fund? Is this going to come out of the IT budget? It's certain, excess funds in the IT budget. Where's this coming from?
Director Murray? Would it come from the Court of Appeals budget or from the IT budget?
Court of Appeals.
Court of Appeals budget.
Even better. Okay, thank you.
I make that motion.
Okay, so we have a motion and a second to approve the OBM technical amendments with the exception that the $80,000 for the Court of Appeals for electronic records would be retained in the budget resolution. Any further discussion? Hearing none, all those in favor say aye.
Aye.
Any opposed, say nay. Ayes have it, and that is included.
Excuse me, Chairman Miller, I did not get the first and second. I didn't hear.
Okay, then what I'm planning to do next is to vote on all of the remaining items as a package, with the exception of any items that anybody says that they would like to have held out to vote on individually. Are there any items that people would like to vote on individually? Yes.
I would like to vote individually on the $500,000 for juvenile court detention overtime. And the reason for that is we provided juvenile court this past summer with 10 CO employees. They have not filled all those spots. They have 6 more, from what I understand, to fill. They keep having people quit and jump back on. But we provided 10 spots for that to be, that should have taken care of any problems, unless I hear differently from the juvenile court. Maybe this is an item we need to discuss further outside this committee or at another time. But we did provide 10 employees specifically for the juvenile justice center detention area. And yet now they're coming back for 500,000 more, and they haven't used all those 10. There's still 6 slots open since summer. So I'd like to have that. And then the shelter program, I think, needs to be discussed a lot further on. We had a great discussion in safety this afternoon. And the reality that I see is you're dealing with different, young adults. But the bottom line is, if you belong in jail, you belong in jail, and if you don't, you don't. And I know that's black and white,
But what we developed is there's this gray area, and the gray area are all these other shelter-type programs. And now we've created yet another part of the gray area that, in essence, in my opinion, is more of a social program. And I can appreciate there are cracks that these kids are falling through. But in this situation, these are cracks created by the juvenile delinquents themselves. And we're going to provide another program for them so that they can't fall through because they're going to be behind locked doors. If they need to be behind locked doors, I think Mr. Greenspan hit something on the head. Let's find one of these jails that wants to shut down and put them in a jail.
Okay. So those two items are held out. Is there anything, Councilman Schwan?
Yes, the rape kits and the DNA.
Okay, fine, that one's held out. Okay. Anything,
Mr. Chairman?
anything else?
Mr. Chairman, I think there was a comment in
It's
response.
because he wants to vote no on the rest of it. It's okay. Anything else?
Mr. Chairman, I think there was a comment in response to the council member's statement.
We'll get to it in discussion. Okay, so, hearing nothing else, what we're gonna do is gonna be, I'm gonna see if there's a motion to approve. Let's vote on the rape kits first. Okay, so we're gonna vote on item number 2, which is the additional $600,000 on the rape kits. Is there a motion to approve?
So moved.
Is there a second? Second. It's been moved and seconded. Any discussion?
Moved by Jack, second by Harrison.
Second.
Lost her edge, huh?
You had this all together, Jan.
Okay. Okay. It's moved and seconded on the rape kits. All those in favor say aye. Aye. Any opposed say no. It is approved. Okay, the next thing we're going to do is we're going to vote on the third item from item number 1, which is the $1,500,000 for residential placements. The item 3, the Personnel Review Commission. Item 4, the City Planning Commission. Item 5, $50,000 for bed bug assistance. Item 6, the Educational Assistance Program, $100,000. Item 7, Department of Sustainability, $220,000. Item 8, Fiscal Office Grants Coordinator Program, $330,000. So is there a motion to approve those items as a package?
So moved.
Okay, it's been moved and seconded. Any further discussion? Hearing none.
The only discussion is based on your comments earlier. That's why I'll be voting no on these.
Clerk will call the roll.
Calling the roll. Ms. Conwell.
Yes.
Mr. Jones?
Yes.
Mr. Hairston?
Yes.
Ms. Simon? Ms. Conley? Mr. Greenspan? Mr. Miller?
Yes.
Mr. Brady?
Yes.
Mr. Germana? Mr. Gallagher? And Mr. Schron?
No.
Motion carries.
Okay. Next item is item number 1 under juvenile court, $500,000 for the detention center overtime. Any further discussion on that item?
Mr. Chair? Can I hear from juvenile court about
Absolutely.
Councilman Gallagher's questions?
Thank you. Marina Cavalier, Court Administrator, and if I heard the question correctly, I believe the comment was made that due to the fact that we were given additional funding to hire additional detention officers, we should have seen an immediate decrease in our overtime. Unfortunately, that is not the case, and the reason that it's not the case is the additional detention officers were still intended to be part of the formula to keep our center safe when the population was approximately 120 to 125. Our goal was to decrease our staff to resident ratio. You may recall a year ago when our population peaked a bit and the unintended consequences of Senate Bill 337, and having then been in the building for 2 years, with the way the design of the building was, we collectively made a conclusion that to keep 120 residents and the staff safe, we needed more staff. And we were attempting to get closer in line with the federal PREA standards. When you gave us the additional funding, everyone hoped that we would be able to, at some point, decrease our overtime costs. Had the population been more stable at 120, we might have begun to see that as an outcome. The next thing that happened, though, during the course of the year were the two first ever unprecedented major racketeering prosecutions that involved 67 juveniles. So as hard as we have worked to get the population down to 120, as hard as we have worked to hire additional staff, we are still way over the numbers that we can safely manage without expending overtime dollars. When I left 9300 Quincy today, our population was at 182. And again, a huge part of these are the 337 residents, the ones we can no longer transfer to the adult jail, and the ones who have just recently been arrested for the second round of the prosecutor's major racketeering filing that they did. So I just thought that I should comment, although we all hoped additional staff would allow us to rely less on overtime, we have not made it there yet because of the high population.
Okay.
Councilman Gallagher.
The purpose of the 10 was because of 337 and the unexpected and unintended circumstances that occurred because of that. The reality is the safety has gone up for everybody because the bad characters were moved out. The reason the bad characters were moved out, the judges and their staff finally had those necessary hearings to move the bad characters out.
That was a huge part of it.
So do we need those 10 spots?
Oh, I would say absolutely, positively.
Okay.
I'm still not convinced that we have enough staff available on all 3 shifts, 7 days a week, to guarantee the safety and security of both the residents and the staff.
I'm just, and I know you're frustrated, and I'm frustrated, and I'm not there and you are. But it just seems to me when we send the professionals in, and I'm talking about the sheriff, and he does a walkthrough, all these cats and kittens get in line. One man walking through does it. Word gets out, and it gets outside the building into the neighborhoods, and you don't have what you had going on there. I just can't understand why we can't get, I mean, nothing negative about what you have over there, but they don't have the professionals that we do downtown who have more discretion with the bad characters they're dealing with. So it's kind of like a dog chasing its tail.
And well, it is indeed very complicated, and I think you have to approach it from all different sorts of angles. And another consideration is the age range today, when I left 9300 Quincy, was 12 years old to 20. That's quite a disparate age range, and having such young offenders. By the way, a slew of very, very young offenders were a part of this most recent large gang filing. But having them to be in the same, it's still a somewhat compacted space. You know, it's one wing basically, age 11 to age 20, provides unique scenarios that do not have to take place at the County Justice Center. The other thing I probably just really should restate, if I wasn't up here saying we needed more money for overtime or we needed more staff because of 337, and the juveniles whose cases are transferred or who are over the age of 18, Sheriff Bova would be up here saying, we need more money because here's 60 more people that somebody's got to be paying for. They have to be detained somewhere. Right now, it's the juvenile detention center, but it would be Sheriff Bova's center, if not us.
And I understand that, and I understand with the pilot program, it's an attempt by the court to think outside the box, to move what I still consider kids that need to be in jail. I mean, they did something to be there. They were put into a program where they were given a little discretion. They broke the rules there, so they have to be put into another program, powder them up, and put them in behind a locked door. I go back to what Mr. Greenspan said. These kids need to be in jail. They're not good kids. And if they've given opportunity after opportunity after opportunity and they keep breaking it, why are we creating pilot programs for people that don't follow the rules? And I know you got to put them somewhere. So let's find a jail and put them behind bars where they belong, and they don't want to be there. But I withdraw my complaint about, or my concern about the 500 and overtime.
Thank you.
I just knew we gave you 10, the 10 weren't hired. I know it's hard to find people, so we can go on from there.
Okay.
Thank you.
We have successfully made offers to multiple people, well over the 10. But turnover is a way of life, actually, in the detention kind of business. It just plain and simply is. We have a perpetual posting, as they do here downtown.
Well,
Just one question, Mr. Chair.
Ms. Connolly and then Councilman, okay, Councilman Greenspan.
So when you originally put your budget together, you were maintaining the PREA standards based on 125 inmates? Is that kind of when you, but now you're at 187 and as a result, or 180 something, and you're trying to maintain your PREA standards with the current inmate level? Is that what's the?
No, when our 2002 to 2012 budget was not meeting PREA standards by any stretch of the imagination. And we had the incredibly inflated population, which continues to inflate. When we came to you in the spring, that was to get us closer to the PREA standards, but with the population being closer to 120 than what it has just continued to be.
Are we missing some certifications or qualifications by not meeting this standard?
No, I would not say that exactly, but it's a wonder that we are able to keep everything as intact and safe as we are.
So we're not in jeopardy of losing any grants or any assistance from the state or federal government based on our failure to meet the PREA?
At this point in time, no.
Okay, all right, thank you.
I would say it's probably more of an aspirational standard that provides you with some sort of security and peace of mind, as opposed to any kind of mandatory or one that includes sanctions if you don't meet it.
Okay. I would just comment that that I'm going to vote for this based on that, as you describe what's going on, I think you need the money. But also, I don't think spending this much money on overtime on a regular basis is an efficient use of resources, and I would ask for your continued working with us to hopefully when we can get more stable conditions, we can find a way so that this isn't necessary. But for now, you need it.
And we couldn't agree with you more. A few years ago, when actually I became the court administrator, I made the declaration that from that day forward, overtime was no longer going to be acceptable in the detention center, driven primarily by concern about the sanity and safety and health of our workforce. We did a tremendous job for almost 3 years, dramatically reducing what our overtime expenses were. But then 337 was passed, and then the population just skyrocketed.
Okay.
Thank you.
Do we have a motion to approve the the $500,000 for the detention center overtime.
Second.
It's been moved by Councilman Jimana and seconded by the council president. Any further discussion?
Mr. Miller, I just want to add that, I understand what Mr. Gallagher is saying, but, there are really very, very stringent laws about juveniles, and if we were to violate those, then we're looking at lawsuits down the line, and, we just can't, in the beginning of the 19th century, we threw children in jail with adults, and you can't do that anymore. So we got some really very stringent federal and state requirements in terms of handling juveniles that we've got to comply with. Like, I think so we got to school and recreation, that kind of stuff. So the alternative, maybe saving money, but in the long run, we're liable to create more criminals, but also get sued and have all kinds of fines and violations. So we have to be very careful with this.
Okay.
I just want to echo Council President's statements as well. And these kids are low-level offenders. I mean, I don't think we can forget that. They're not kids who are creating or committing violent offenses, which would land them in the detention center. These are low-level offenders that have to be contained and potentially can get into the sex trades or whatever they do, the trafficking. And so it's a little different than just saying lock them up. Maybe the kids who need to be locked up, I think, are getting locked up. And I think long run, this will save us money. So these just are kids that are a little different. And I think it's really important to be creative and to try different programs. And if this will be successful, maybe we can convert one of the municipal jails at some point into a center for these types of kids. So that's my only comment. These are different kids.
Okay, we have a motion on the detention center overtime. All those in favor say aye. Aye. Any opposed say no. Ayes have it. And we're on the shelter pilot program. And on this item, a lot of questions have been raised, and I don't think it's urgent. I would see if the committee would be amenable to referring it for some further discussion in Public Safety Committee. Would anybody have a problem with that? Okay, well then we will refer that item to Public Safety Committee. And the question now would be, I'll make the motion. It would be to approve Resolution 2014-0267 as amended with the items that have been approved for consideration for second reading suspension at the December 9th council meeting. And it's with the understanding that the administration will prepare us a substitute containing the exact technical language incorporating these changes, which we will need to pass at the council meeting. Is there a second? Second. Okay, multiple seconds. We'll let Jean decide who made the loudest second. Conwell, I think that's right. And any further discussion? Hearing none, the clerk will call the roll.
Calling the roll, Ms. Conwell?
Yes.
Mr. Jones? Yes. Mr. Hairston?
Yes.
Ms. Simon? Yes. Ms. Conley? Yes. Mr. Greenspan? Mr. Miller?
Yes.
Mr. Brady?
Yes.
Mr. Germana?
Yes.
Mr. Gallagher?
Yes.
Mr. Schron?
Yes.
Motion carries.
Okay, thank you very much. I don't think there's anything under miscellaneous business. Is there any public comment unrelated to the agenda?
Well, Mr. Chairman, Reverend Pinckney Butts has requested to address council.
Okay. Welcome back. You have 3 minutes.
God bless you. Good evening, everyone. I came here actually for a meeting with Director Werner, and ended up in here for another reason. I came in as you all were discussing your budget, or our budget, and I asked you to look further and deeper. I'll wait till they finish. I ask you to look further and deeper into allocating funding addressing this violence against these women and children. I've asked you this before, You speak, the Word of God talks about not killing and honoring your parents, and these are the laws, and we're supposed to be creating laws that implement this process. But we teach our children violence, and then we expect them to not be violent. When you have police officers and sheriff's deputies downtown on Public Square with guns and tasers saluting people as they get off of the transportation and they go from one area to another, you're teaching them violence. You cannot be hypocritical in your processes. And anytime you make a specific rule for one race that you don't apply to another, you are promoting more violence. Anytime a white male officer can get and shoot 2 black people, and people were killed with 137 shots, you don't kill a bear with 137 shots. But then you want to prosecute children for doing what you teach them, and then you want to refer to children as kids when it's a predominantly African American race of children or multiracial American children. But when it's not, then it's something wrong. It goes into a program, it goes into some type of maybe process, and then you want to allocate things according to people who are mentally ill being criminals. A woman just got killed right in front of her family because she was accused of being mentally ill, and the police are justified in doing so. Look further. Look deeper. Stop spending your money on all of this violence. It is time for it to cease and to desist. From the cradle to the grave, you teach violence. The birthing process, you hit your children when they're born. You spend money to build a stadium off of alcohol and tobacco and drugs, and a child just got killed from a gun that you all spend money producing the products to make guns, and you take prayer out of the school? I challenge you. I'm tired of the violence. I didn't even allow anyone to hit my children when they were born, no matter how they were conceived, because I conceived them even in violence. It's time to change the process for the law to really work. It's time to close these jails. No child, they're not kids. Goats are kids, baby goats. It's time to shut this stuff down and give these children a life. They're not heathens and they're not animals. I don't promote racism, whether it come from black supremacy or white supremacy. It's time to go back to the drawing board. Thank you.
Thank you very much for your testimony. Any other miscellaneous business? Is there a motion to adjourn? So moved. All those in favor say aye. Aye. Thank you very much, everybody.